Welcome back to Real's Dissect the Question series. The best use of this video is to pause it, try to answer the question, write down a brief explanation, and then restart the video and compare your answer to ours. A 15-year-old boy diagnosed with cystic fibrosis at birth is brought to his pediatrician by his mother. The boy has had mild respiratory and gastrointestinal symptoms throughout his life, but is now concerned because he's having frequent diarrhea with foul-smelling, greasy stools. The boy is referred to a gastroenterologist who performs duodenal intubation to sample the boy's duodenal fluid following ingestion of a high-fat test beverage. Results of the duodenal intubation show decreased volume of fluid, duodenal fluid, suggesting obstruction of the common bile duct with thick mucus. What other findings are likely to be reported for the boy's postprandial duodenal fluid analysis? Well, we have cystic fibrosis with thick mucus that we know is due to the CFTR mutation. And that thick mucus is not only in the respiratory tract. It says here that the patient has respiratory and gastrointestinal symptoms throughout his life, but it seems the gastrointestinal symptoms are getting worse. The physician thinks there's obstruction of the common bile duct. Is that what we expect in cystic fibrosis? Well, we have a stomach here, and then we have a duodenum, and we have a pancreas, that's connected to the duodenum. Also, the gallbladder connects through a common bile duct. And we're concerned that thick mucus, which is the main defect of the CFTR. CFTR is a chloride channel. The abnormal chloride channel causes mucus to become thick. So we think there's blockage here. There's some sort of blockage here. And that's our mental model that we start with. So now we look at the choices, A, B, C, D, and E, and look for something that's going to what? Be affected by this blockage in the duodenum, because we're what? Sampling the duodenal fluid. We're sampling through a catheter this duodenal fluid. This is our sample. Okay? So, if we block the duct from the pancreas, what do we expect? Well, we have to know what the pancreas is making. The pancreas is making for the duodenum bicarbonate to alkalinize or neutralize the acid from the stomach. Remember, HCl is coming from the stomach? So the bicarbonate in the pancreatic juice that's transported through the pancreatic duct and common bile duct to the duodenum or duodenum is supposed to have a high concentration of bicarbonate right here. This is where the bicarbonate should be. High bicarbonate. Okay? So if we're blocking the duct, we certainly can't have higher than normal bicarbonate, right? We'd have lower than normal bicarbonate. What about chloride? Well, chloride's also in the pancreatic juice. No, higher than normal chloride can't be. It's going to be lower than normal if we block the duct. But what about lower than normal pH? Well, if we don't have bicarbonate that's supposed to raise the pH, we certainly would have lower than normal pH, wouldn't we? So we're supposed to have a high pH in the duodenum. We now have a lower than normal pH. But we can't stop there, even though we think that's the best answer up to now. We have to look for additional answers, because sometimes there's two answers and we're always expected to select the best one. Now, another thing that the pancreas makes is what? Digestive enzymes. And two of the famous digestive enzymes are pancreatic amylase. Remember, we also have amylase in our saliva, so that's why we have to put the P there. It's not salivary amylase, but it's pancreatic amylase. And pancreatic lipase. We have lipoprotein lipase in the endothelial cells of tissues that need to take up fat. We have adipose tissue lipase, also known as hormone-sensitive lipase, in fat tissue, adipocytes. So we have to use the P so we know that's pancreatic lipase, which is the digestive lipase coming from the gastrointestinal tract. Well, if we block the duct and there's no amylase and no lipase, then we're going to have a higher than normal level of starch and triglyceride that's coming from our food that needs to be broken down. We don't have the enzymes to break it down, so we're going to have a higher than normal level of starch and a higher than normal level of triglyceride. So the higher the normal level of fat, triglyceride, certainly explains the what? Patient's complaint of foul-smelling, greasy stools, known as steatorrhea, a very common finding in cystic fibrosis patients.